The Spanish flu pandemic of 1918-1919, one of the deadliest in human history, occurred towards the end of World War I. The exact origins of the virus are not definitively known, but it is thought to have originated in birds and mutated to infect humans. Several theories suggest that the first cases may have appeared in military camps in Europe or the United States, where conditions were ripe for the spread of infectious diseases, overcrowding, global troop movements, and poor sanitation. The rapid spread of the Spanish flu was facilitated by a combination of factors. The movement of millions of soldiers and the large war gatherings broke down normal barriers to disease transmission. Additionally, wartime censorship kept news of the outbreak under wraps, preventing timely public health responses. This lack of information and preparedness allowed the flu to spread unchecked at a time when international travel was becoming faster and more frequent. The virus itself was particularly virulent, with a strain that led to severe respiratory complications. Its impact was catastrophic, infecting about one-third of the world's population and killing an estimated 50 million people globally. High mortality rates were not only due to the aggressive nature of the virus but also to the compromised health of populations due to the ongoing war and previous waves of other infectious diseases that had already weakened many individuals' immune systems. Public health responses varied, with some cities implementing measures such as quarantines, mandatory mask wearing, and public gathering bans, which in some cases slowed the spread but were often too little, too late. The pandemic eventually subsided by the end of 1919, as those who were infected either died or developed immunity. The Spanish flu left a lasting impact on public health policy, highlighting the need for better disease surveillance and more coordinated response strategies in future outbreaks. The Spanish flu of 1918-1919, one of the deadliest global pandemics in human history, profoundly affected approximately one-third of the world's population, with around 500 million people infected. The pandemic caused an estimated death toll of between 50 million and 100 million individuals, surpassing the fatalities of World War I, which had just concluded. The virus was particularly lethal to the typically resilient young adult demographic, aged between 20 and 40 years, resulting in unusually high mortality rates. This age group experienced severe complications like pneumonia, significantly contributing to the high death toll. The widespread infection and high mortality rate led to massive social and economic disruptions, with many businesses and essential services crippled due to the lack of healthy workers. In an attempt to stem the spread of the Spanish flu, various public health measures were adopted, though their implementation and effectiveness varied greatly. Infected individuals were isolated from the healthy population, and quarantine measures were enforced for households or entire towns with reported cases. Many communities mandated the use of masks in public settings, which, despite varying levels of effectiveness, became a symbol of public health efforts during the pandemic. Social distancing measures were widely introduced, including the banning of public gatherings, closure of schools, theaters, and places of worship, and the cancellation of crowded events. These efforts were aimed at reducing the risk of transmission among large groups of people. Public awareness campaigns played a critical role in educating the population about the importance of hygiene practices. These campaigns promoted regular hand washing, covering coughs and sneezes, and encouraged people to avoid public interactions if they felt sick. Enhanced efforts were also made to disinfect public spaces, and personal hygiene was strongly emphasized as a crucial preventive measure. Despite these extensive efforts, the public health response to the Spanish flu was often fragmented and reactive. The pandemic eventually subsided largely because of the natural decrease in the number of susceptible hosts and the development of herd immunity among survivors. The catastrophic impact of the Spanish flu underscored the need for more coordinated public health strategies, leading to significant reforms in public health systems and the establishment of organizations dedicated to managing such threats on a global scale. The Spanish flu pandemic of 1918-1919 concluded by 1920, with the decline of susceptible populations and the emergence of herd immunity among survivors. The specific H1N1 virus strain that caused the pandemic didn't disappear but instead evolved over the decades, influencing the genetic makeup of future flu viruses. Today's influenza viruses, including those responsible for seasonal flu and other pandemic strains, are descendants of the 1918 virus, although they have undergone substantial genetic changes. To prevent influenza, a combination of measures is employed, based on the understanding gained from past pandemics like the Spanish flu. Vaccination is the cornerstone of flu prevention. Annual flu vaccines are formulated to match the influenza strains predicted to be most prevalent each season. Public health officials recommend that everyone aged 6 months and older receive the vaccine every year to maintain protection against the evolving virus. Maintaining high standards of personal hygiene is another critical preventive measure. Regular hand washing, using alcohol-based sanitizers, and practicing good respiratory hygiene, such as covering coughs and sneezes properly, are effective ways to reduce the spread of the flu. Environmental cleaning routines that include the regular disinfecting of frequently touched surfaces and objects also play a significant role in controlling transmission. Social distancing remains a valuable practice, especially during the peak of flu season or during outbreaks. Keeping a safe distance from those who are sick, avoiding large gatherings, and staying home when exhibiting flu symptoms can prevent the spread of the virus. Public health campaigns contribute significantly to influenza prevention by raising awareness about the importance of vaccination and effective hygiene practices. These efforts are supported by the availability of antiviral medications, which are particularly useful for treating flu in high-risk populations and can lessen the severity and duration of symptoms. Today, the global health community, including the World Health Organization and national health bodies, maintains a robust surveillance system to monitor influenza activity. This system helps in quickly identifying flu outbreaks and informs the annual updates to vaccine formulations. This level of preparedness and ongoing vigilance is a direct legacy of the response to the Spanish flu, ensuring the global community remains equipped to manage influenza effectively.